Now, how can we improve patient compliance? I think that's another very important topic.
Yeah. So I think patient compliance improves with proper patient education. Again, going back to that cause and effect. So a lot of times you do not need to tell the patient what to do if they can see the effect of what you just gave them. But otherwise, you got to be very, very clear in establishing baseline. So I'm a big believer in having a pre-test, do a pre-test before doing your repeated movements, and then going back and doing the same baselines as post-tests. Another trick in patient compliance is making sure that they understand. And then I got to tell you this, because I was notorious for doing this in the beginning as well. I was one of those McKenzie clinicians who would instill fear in my patients and against flexion. So I would tell them, okay, you do not ever want to flex. Extension is the way to go. This is your direction that reduces your pain. So whenever you flex, you're pulling yourself apart. So in the initial stages, that might be appropriate. But then now I'm realizing that it's really important when you give that instruction to stop something that is aggravating or offensive to the patients. For example, you've got somebody who's an extension principal responder. So when you give that instruction, I want you to do these exercises and avoid flexion, it's very important to caveat that avoidance is only temporary. Because then they start thinking, okay, this is something that I can't ever do or I shouldn't be doing. And then you're giving that patient an instruction to perform the exercise every hour, every 2 hours, and they get very just discouraged. It's overwhelming. And the patient is thinking, okay, am I going to have to do these exercises for the rest of my life? So I think to caveat and say, okay, this is just temporary. You are making an effort to be more comfortable in the future. It's an investment. Once your body is ready, we're going to go back to doing those things that you stopped doing. So having that reassurance, you're going to go back there. It's these things that you can't do now, that bending forward, at some point, once you are healed, you're going to be able to go back and do them again. It's like wanting to wear high heels. When you sprained your ankle, you are not ready to wear those heels yet. But guess what? Once that sprain heals, you can go back and wear your high heels again. All right.
Yeah.
So things like that, I think that's part of improving patient compliance. So that way they don't get discouraged. They have something to look forward to. Setting expectations. So not just in derangements. I tell folks with your dysfunction patients, right? Those folks who have had long-standing problems that will need time or take time to remodel. I don't know about you, Mariana. These are the patients who often don't come back, right? So you see them for a few sessions and then they're going home hurting themselves. They never want to come back, right? Because they expect to get better and they don't get better fast. So I think having a good sit-down education with that patient, setting expectations, you tell them, okay, you're doing this because you're trying to remodel the tissues. You want to develop a longer, healthier tissue. Right now, it's going to hurt, but over time, within 3 to 4 weeks, so set expectations. Within 3 to 4 weeks, you should see measurable outcome. So they don't get too discouraged and they're more likely to comply. So,
absolutely.
And another thing, yeah, you agree with that?
Yeah, 100%. If you don't tell them what to expect, they are going to get discouraged and not come back.
Absolutely.
For sure.
And the other, I think, important aspect of compliance is being very good at writing down what you ask them to do. So I'm a big believer in writing down home programs. And nowadays, I don't know if you do this with your patients. Nowadays, I'm finding that using their smartphones, if they have their smartphone, I would, and instead of writing it down, sometimes I'd have them take a video. So I'll take a video of their exercise. While they're performing their exercise, I do the video, and then they can just easily go back to that video and watch themselves exercise. So they're more excited to do that. And it's not a violation of HIPAA, right? Because they're using their own phone. as long as you're not using your own phone. So just little things like that, being clear with your instructions and using tools to be able to help that patient comply with the exercise program.
And I think that's very useful because sometimes they repeat and they say that they learn and understand, and then they go home and they do something completely different. So just to keep, and then they get back and they say like, oh, you know, I'm not really better. And then you ask them to show the exercise and they're doing something completely different. So
completely different. So you got to be very clear. So little things like that, the nuances, and I'm sure a lot of folks are doing that already, but I thought it's important to emphasize that.